This news comes after the agency announced changes around the use of COVID vaccines for most adults and children.
So with yet another announcement here around vaccines, you might be wondering what you should know before cases start to ramp up again.
That's right. Megan Bragg verifies for us tonight.
This announcement comes a week after the Trump administration says it plans to limit approval for seasonal COVID shots to seniors and others at high risk. To verify what this could mean for families, we went to these sources: New England Journal of Medicine, cardiologist Dr. Pyle Coley, and Dr. Carla Robinson with Urban House Call. In a paper recently published in the New England Journal of Medicine, the FDA commissioner and vaccine chief say they want to see data from new clinical trials that show COVID shots are still safe and effective before approving them for healthy adults and children. This requirement could limit who gets new shots each year. So why do we get yearly COVID shots? Both doctors explain how it can impact the community.
I like to tell people that it's very similar. When you think of COVID vaccines and getting them regularly or annually, it's the same thing as the flu, where the virus may mutate from season to season.
Vaccinating healthy people actually even protects the most vulnerable people in society because it makes the spread of the virus less effective, less efficient. So that's called herd immunity. If people around me are vaccinated, it actually makes it less likely that I'm going to get the infection, even if I haven't received a vaccine, even if I'm a susceptible member of society.
Previously, the FDA typically approved updated COVID shots for all Americans each year based on simple tests that show they trigger a strong enough antibody response.
The recommendations are 6 months and older, you are eligible to get the COVID vaccine. And so at this point, as it stands, we still follow those guidelines. And if you're in that population, we recommend vaccination.
However, in the paper, the FDA employees argue the one-size-fits-all COVID vaccine policy approach is outdated and no longer in line with other countries. They do say, though, that drug makers can still use smaller studies to get approval for adults 65 and up, as well as high-risk children and adults. Now, if you are concerned about your access to vaccines, reach out to your primary care provider. With your Verify, I'm Megan Bragg.